Hello, I'm Blaze. We will talk about types of medical fields, Part 9. Part 9, Pediatrics. Pediatrics, also known as underage medicine, is the branch of medicine that involves the medical care of infants, children, adolescents, and young adults. Within the Commonwealth, pediatrics covers patients until the age of 18, except in India where the pediatric age is 12. Skills are required to become a pediatrician, including communication and interpersonal skills, which requires ability to interact naturally with children, explain complex medical information to parents, and pick up on nonverbal cues. Problem-solving and clinical judgment, where strong analytical abilities are necessary to assess symptoms in patients who cannot always communicate their issues, such as infants. Patience and empathy, by managing scared or uncooperative children, requires a calm temperament and compassionate approach to build trust. Decision-making and critical thinking, by making correct treatment decisions, especially in high-pressure or emergency scenarios. And emotional resilience, the ability to handle high-stress situations, such as caring for very sick children, and to process emotionally difficult outcomes. Aspiring medical students will need 4 years of undergraduate courses at a college or university, then future pediatricians will need to attend 4 years of medical school, and later do 3 more years of residency training. Pediatric physiology directly impacts the pharmacokinetic properties of drugs that enter the body. The absorption, distribution, metabolism, and elimination of medications differ between developing children and grown adults. Despite completed studies and reviews, continual research is needed to better understand how these factors should affect the decisions of healthcare providers when prescribing and administering medications to the pediatric population. Pediatricians often have to treat the parents and sometimes the family, rather than just the child. The concept of legal consent combined with the non-legal consent of the child when considering treatment options, especially in the face of conditions with poor prognosis or complicated and painful procedures, means the pediatrician must take into account the desires of many people, in addition to those of the patient. So, this video is about pediatrics. Like, comment, and subscribe now.